I'm at Baptist MD Anderson Cancer Center, and today we're talking about prostate cancer with a urologic oncologist. I've never actually met one before, so nice to meet you. This is Dr. Barrett McCormick. Thank you for
Very nice
joining
to
us.
meet you. Thanks for coming.
And I want to learn a little bit more about prostate cancer. Of course, all the men in our lives, so tell me a little bit about what exactly is prostate cancer.
Sure. So the prostate is an organ that is involved in the male urinary and reproductive system. It is about the size of a walnut. Prostate cancer is actually a malignant transformation of some of the gland cells that are in the prostate. And prostate cancer is actually the most common type of cancer in men in the United States, with approximately 200,000 new cases per year. And it's actually the second most common cause of cancer death in men in the United States, with approximately 30,000 deaths per year.
Wow. And so what are some of the signs and symptoms?
So that's a great question. And, that's one of the really challenging aspects about prostate cancer management. Typically, prostate cancer does not have any symptoms.
Oh, really?
And that's why we rely heavily on screening programs to try and identify men that may be at increased risks. In some situations, especially as men get older, they can have changes to their urinary streams, increased frequency, urgency, getting up at night, things of this nature. Typically, this is associated with benign causes, but it's important that a man be screened by his primary care physician or his urologist to make sure that there are no signs that could be suggestive of possible prostate cancer.
You mentioned urologist. So what is the difference between a urologist and a urologic oncologist?
It's a fantastic question. So generally speaking, urologists are trained to deal with urologic malignancies. It's a big portion of any general urologist's management approach and their training, but as urologic oncologists, we have specialized training in the most up-to-date management of some of these malignancies. And so in certain situations, if a patient's general urologist does not feel comfortable with the management, they can certainly refer their patients to us for an increased level of expertise in terms of surgical management, as well as the multidisciplinary approach that we provide here at the Baptist MD Anderson Cancer Center.
Do you recommend a certain age for screening?
Absolutely. So certain men are at increased risk of developing prostate cancer. We know that there is a hereditary component, and so men that may have a first or second degree relative with a history of prostate cancer should be screened at an earlier age. Additionally, African American men are at an increased risk. Interestingly, generally speaking, men in the Western portion of the world are at increased risk of developing prostate cancer compared to men in other parts of the world. We know that there are some relationships with some genetic mutations that we find in breast and ovarian cancers, and so we screen for these patients in terms of seeing if there are any female members in their family that may have had those malignancies, as well as certain colorectal cancers may put a man at increased risk. If a man does not have any risk factors, the American Urologic Association recommends that screening begin at the approximate age of 55 and then be carried to approximately the age of 69. This can be carried beyond that if necessary after an appropriate conversation between the patient and his physician.
You were mentioning screening, and can you explain what PSA screening is and the pros and cons?
Absolutely. So the PSA stands for prostate-specific antigen. This is a normal enzyme that is produced by the cells of the prostate. And so in all men, we expect to see a normal value. Increased levels of this that are detected through a routine blood test can suggest the possibility of an increased risk of prostate cancer, but not in all cases. And so we use that oftentimes in conjunction with an examination of the prostate to see if a man may be at an increased risk. If this is the case, we may consider potentially proceeding with a biopsy of the prostate. In terms of the pros and the cons, we certainly know that prostate cancer screening works and is extremely effective, and this is why we place a huge emphasis on this. We know that men that undergo screening demonstrate lower stages of disease at identification. We know that the risks of metastatic disease at presentation, and in fact, the overall risk of mortality or death due to prostate cancer is lower in men who are screened compared to those who are not. From a con standpoint, certainly if a man is offered a prostate biopsy, this can have some procedure-related complications, although very uncommon and typically minor. Additionally, one of the challenging things about prostate cancer is that in some situations, it may not need to be treated at all. That is to say that there are some types that are more aggressive or more dangerous, whereas other types may not be that. And this can be really challenging for patients to understand because a lot of times people hear the word malignancy and they think that it needs to be treated.
Right.
But again, we emphasize here that we have a multidisciplinary approach, and so when patients are evaluated here, they have the opportunity to meet with myself as a surgeon, our colleagues in the radiation oncology department, medical oncology, as well as a whole host of other providers that can provide them with all of the information they need to make the decision that is best for them. We don't want our patients to feel like they are being pushed into one direction or the other, and we think that's what really sets us apart.
Where can people get more information?
Absolutely. So this can always start with a frank conversation between the patient and their primary care physician. We are also more than willing to see patients and have these discussions with them here. They can also get more information at our website, which is baptistmdanderson.com.
Thank you so much. This is very informative, and don't forget to get screened. All right, and if you'd like to see this segment again or get more information, go to firstcoastliving.net.